World Hypertension Day. It is very important to understand hypertension. Hypertension is other names for high blood pressure. It can lead to severe health complications and increase the risk of heart disease, stroke, and sometimes death. Hypertension is a primary risk factor for cardiovascular disease, including stroke, heart attack, heart failure, and aneurysm. Keeping blood pressure under control is vital for preserving health and reducing the risk of these dangerous conditions. Blood pressure is the force that a person's blood exerts against the walls of their blood vessels. This pressure depends on the resistance of the blood vessels and how hard the heart has to work. Prevention and treatment. Lifestyle adjustments are the standard, first-line treatment for hypertension. We outline some recommendations here. Physical exercise to be checked blood pressure regularly. Current guidelines recommend that all people, including those with hypertension, engage in at least 150 minutes of moderate intensity, aerobic exercise every week, or 75 minutes a week of high-intensity exercise. People should exercise on at least 5 days of the week. Suitable activities are walking, jogging, cycling, or swimming. Stress reduction. Avoiding or learning to manage stress can help a person control blood pressure. Meditation, warm baths, yoga, and simply going on long walks are relaxation techniques that can help relieve stress. People should avoid consuming alcohol, recreational drugs, tobacco, and junk food to cope with stress, as these can contribute to elevated blood pressure and the complications of hypertension. Smoking can increase blood pressure. Avoiding or quitting smoking reduces the risk of hypertension, serious heart conditions, and other health issues. Medication. People can use specific medications to treat hypertension. Doctors will often recommend a low dose at first. Antihypertensive medications will usually only have minor side effects. Eventually, people with hypertension will need to combine 2 or more drugs to manage their blood pressure. Medications for hypertension include diuretics, including thiazides, chlorthalidin, and indapamide. Beta blockers and alpha blockers. Calcium channel blockers. Central agonists. Peripheral adrenergic inhibitor. Vasodilators. Angiotensin converting enzyme ACE inhibitors. Angiotensin receptor blockers. The choice of medication depends on the individual and any underlying medical conditions they may experience. Anyone on antihypertensive medications should carefully read the labels of any over-the-counter (OTC) drugs they may also take, such as decongestants. These OTC drugs may interact with the medications they are taking to lower their blood pressure. Diet. People can prevent high blood pressure by following a heart-healthy diet. Reducing salt intake. People's average salt intake is between 9 grams g and 12 grams per day in most countries around the world. The World Health Organization (WHO) recommend reducing intake to under 5 gt roasted sauce a day to help decrease the risk of hypertension and related health problems. Lowering salt intake can benefit people both with and without hypertension. The American Heart Association (AHA) recommend the following would count as one drink. Eating more fruit and vegetables and less fat. People who have high blood pressure or people at high risk of developing high blood pressure should eat as little saturated and total fat as possible. Instead, experts recommend whole grain, high fiber foods. A variety of fruit and vegetables, beans, pulses, and nuts. Fish rich in omega-3 twice a week. Non-tropical vegetable oils, for example, olive oil. Skinless poultry and fish. Low-fat dairy products. It is important to avoid trans fats, hydrogenated vegetable oils, and animal fats, as well as large portion sizes. Some fats, such as those in oily fish and olive oil, have protective effects on the heart. However, these are still fats. While they are typically healthful, People with a risk of hypertension should still include them in the total fat intake. Take care of yourself because prevention is better than cure. Stay safe and healthy.